align with this chapter. Okay, so chapter 25 is shared with maternity, OB, but so we're going to do a portion of this. So according to the book, the newborn period is that infant is defined as really 1 year, up to 1 year. So consider that first year of life is the infancy. When we think about that, the growth and development in that time period is really interesting, because when you think about an infant, how when they're born and then what they do at a year old, that's a lot of growth and development in that year. So a lot of milestones are met. It's probably the only time in your life that you'll really have that much, have the most development. So we talk about growth and development. We talk about the growth as an increase in size. So that's easy. You can weigh them, you can look at them. And then development is more about what can they do. So when an infant's born, they don't do a lot, eating, sleeping, things like that, crying. But as they go through certain stages, they're going to be developing their gross motor skills, and then they're fine. So those are more of tasks that they can do. And an infant, we talk a little bit about when they roll over, when they sit up, when they start crawling, when they start walking, things like that. That's development. And then maturation is how the body systems become more mature as they develop. So the one thing I'm going to say, there's a caveat to expecting infants to be able to meet those milestones is if they are immature or premature. Sorry, not immature, premature. And so if you have a premature infant, then you have to adjust that age. So you subtract the amount of weeks that they were premature. So if they were 8 weeks premature, you're going to subtract that, and that's where they should be developmentally. And you're going to use an age-appropriate developmental growth chart, which we'll talk about in our virtual class. And so those milestones have to be adjusted. So you may have a parent say, you know what, my baby is not sitting up, and they should be, because all my friends' babies of that age are sitting up. And you have to remind them that maybe that baby was premature, and then you can adjust that for them. So what's the nurse's role in this development? So anticipatory guidance. So we talk a lot about this throughout the class, is that giving those parents the tools and information they need to keep their child safe. So if you think about when a child starts crawling, you don't want to wait until the child starts crawling to let the parents know, hey, they're crawling, they can get into things, they can fall downstairs, they can put things in their mouth. You want to give them that guidance ahead of time. Same with walking, rolling over, any of that. Before a baby can roll over, you can put them down on the floor and they'll stay there. You can walk away. But once they start rolling and scooting, things like that, then you have to worry about what they're going to get into or just keeping them safe. So giving them those tools. You don't want to wait until a patient comes into your clinic or hospital and the parents say, oh, they fell off the dressing table. You don't want to say, okay, well, they can roll now. That hopefully that education was done before that time. So play is the work of children. It's all they have to do in life. They play. If that was only our job all in life is to play. But the parents need some guidance in this area as far as, what toys to use, what their child will be doing. Typically in the infant stage, we see solitary play. So they're just playing by themselves when they're old enough to play with toys and things like that. Maybe towards the late infancy stage, 12 months, they might have some parallel playing, which is when they're playing next to each other, but they're not interacting between them. So say 2 1-year-olds are sitting on the floor playing with a truck, but they're not interacting or playing together. And then early learning. Early learning is really the way that children begin to develop. So parental interactions, reading to kids, just being attentive to their needs, all is the way they would develop. So every age group has a theory, according to Erik Erikson. So Erik Erikson is one of the theorists for children. Actually, he goes all the way into adults, but we only are worried about the children. And it's the psychosocial development. So according to Erik Erikson, the crisis or the stage conflict is trust versus mistrust. So what this theory is based on is that when an infant is born, they end their first year of life, they're relying on someone else to meet their needs. And so that trust is very important, that they feel that in that first year. If they don't get that trust, the theory is that they will have trust issues the rest of their life. So parent or primary caregiver is the one that needs to attend to their needs. And so if there's inconsistency in that, then this is when there's going to be trust issues. And so table 25.2 goes over some developmental theories that we'll talk about, and Erikson is in there. So basically for this psychosocial development, you want to make sure the baby is fed when they need to, changed when they need to, crying they're attended to, all those type of things, fed when they're needed to. And the thing is with babies who don't meet those, in situations that I've experienced, such as babies born to mothers that are on drugs, these babies are sometimes separated from the parent, and are in maybe the nursery for babies who are withdrawing from drugs. So those babies may not get that trust. The nurses try to attend to their needs, but they're taking care of several babies at a time, and some parents are not allowed in to see their babies depending on the situation. Their goal is always reunification, but sometimes that's not possible. As that nervous system matures in this age group, they will realize at that point the separation from their caregivers, and so they will be more tolerant to some of the mistrust issues. But in that first stage, it's really important that their needs are met. Another theorist is Piaget, and that's the theory of cognitive development. And so for this theory, usually it's referred to as a sensor motor stage. So think about they are learning about themselves, they're putting things in their mouth, and they, as they grow further into this, they may have some types of object permanence where they know if you show them an object, take it away, they can remember it again. And then they're divided into different sections. You don't need to go into all those to remember, but just so that you are aware that it is the sensor motor stage, and that follows them all the way to 2 years. Gross motor skills. So think about gross motor skills are the large muscles. And so head control, rolling, sitting, walking, things like that. They develop in a cephalocaudal growth, so that's head to tail. But in this case, in kids, we say head to toe. But some basic averages that you can go by is kind of related to a song that you may or may not have ever heard of called Head, Shoulders, Knees, and Toes. And so head control should be about 1 to 3 months. So before that, you really have to support their head. Also do tummy time so that they can learn how to get some strength in their head. Shoulders, about 4 months, they will learn to roll from side to side. They should be doing that by then. Knees, so they should be able to get up on their knees and start crawling about 9 months. And then toes, they should be walking about 10 to 12 months. So just a basic guide, and you can kind of see those mapped out on table 25.3 in chapter 25. Anytime we see some issues with their development, we have to recognize those, and it's important for nurses to know basic motor skills. So if a child's not walking by 15 months, that's a red flag. Red flags are something that has to be investigated, and the sooner things that are investigated, the sooner, the better the outcome is, because they can intervene. So we have to kind of be aware of it. If you're working in the hospital and they bring a child in who's 15, 18 months and they're not walking yet, that should be a red flag to you, and maybe you need to investigate more about that issue. Fine motor skills. So fine motor skills are more the developed proximal distal, so from the center to the periphery. So before a baby can pick up a piece of food or something like that, they will just start batting around their hands, and then pretty soon they'll be able to refine those skills. Sensory development. So we're going to talk a little bit about sight. So for sight, newborns are nearsighted. They prefer seeing the human face, and they prefer black and white stripes. They are not able to see colors right away. So this is a picture of a mobile, a really beautiful mobile that actually the baby can't see at this point. So they can see it later on in life, but they really won't be able to see any of this. Hearing should be at birth. Hearing should be fully developed at birth. And so they do hearing tests when the babies are born, and then if there's any issues, they'll follow those up. They prefer the sound of human voices rather than your dogs barking or things like that. At about month age, they can recognize those voices. Smell and taste. So 7-day-old infant can really differentiate between like their mother's breast milk smell and other ones. And they prefer sweet smells, which we talk about when we're going to do any procedures on children, on infants and kids, how in this age group, in the infant stage, we use something called Sweeties or sucrose water to dip their pacifier in, and they love it, and it's supposed to act like, give them like feelings of being on morphine. So again, it's sweet and they love it. Touch, babies need touch. They need to be cuddled and swaddled and held and know that they are comforted. So that's really important. In cases of postpartum depression, which you'll learn about in OB, sometimes that sense of touch is not there, and so those babies sometimes are more cranky. And so then warning signs. So if the young infant doesn't respond to loud noises, that's a problem. They may have a hearing problem. They don't focus on objects. We can think about some sight problems. They should start to babble around the age of 4 months. If not, that's an issue. If they don't look to locate sounds, and if they cross their eyes most of the time at 6 months, that's unusual. Before that, we do see some eye crossing. So language development. So of course, their first language is crying. When we think about it, infants will cry when they're hungry, cry when they're in pain, cry when they're wet, things like that. They'll progress to like cooing, laughing, squealing, and pretty soon understanding certain words as they get towards the year age. Infants who don't make sounds by 4 months, another red flag. If they don't laugh or squeal by 6 months of age, that something's wrong neurologically. Typically around the 3-month age, you can talk to a baby and they're in love with the world. But ones that aren't, then we have to do some investigation. And if they don't babble or use single words. So just some things that we are aware of. Another, some other things with infants is stranger anxiety. So um, they go through a stranger anxiety stage. So it's when they have that, that means they're recognizing themselves separate from others. Separation anxiety, that's when the parent leaves, and that happens about 6 to 8 months. It manifests again in toddlerhood. Some red flags. So no smiling by 3 months. I told you the other one said laughing by 6 months. They don't want to cuddle. They don't aren't interested in peekaboo. Those are some red flags that we need to be aware of. Temperament. So really depends. All babies are different. There is something called colic, which is a paroxysmal crying for no medical reason, and that's hard for parents to adjust to. But as far as temperament goes, every baby has its own temperament, and the parents will learn that and understand it. So it's it's sometimes, like I said, frustrating for babies who cry a lot. And then cultural differences. There may be some differences in culture in raising an infant. Certain ethnic groups could be genetically shorter than others. Feeding protocols could be different. Vegetarianism in children, infants and children, when they start eating foods, needs to be closely. They need to be closely monitored to make sure that they're getting enough nutrition. Different parental styles, health beliefs. Some may believe that they don't see physicians for, regular checkups, well checks. And then one of the big ones that we see that I've experienced is bed sharing. So, we have decreased the incidence of SIDS, which is sudden infant death, over the last, I don't know how many years, when we started putting babies on their back, so back to sleep. But some cultures there's just some people who just bed share with the infant, and that's very dangerous. Co-bedding can lead to death. So I understand parents do it. If you're breastfeeding, it's easy just to, wake up, breastfeed the baby, let it go back to sleep. But you could roll over on the baby. You could push the baby onto the floor. Incidences of issues with co-bedding I've seen is a baby mother rolled on the baby rolled off and got caught between the nightstand and the bed and died. We've had parents roll around the baby and suffocate them. So it's there's a lot of education out there to prevent co-bedding. There are some cultures that believe in it. Same with car seats. Some cultures don't believe in car seats. So we have to do the education we can using evidence-based but respect their cultures too at the same time, which is sometimes hard. So safety is huge in every age group of kids, because remember, they're expecting that all adults are responsible, right? And they're not, unfortunately. So we see falls, electrical outlet issues, hot stoves, mop buckets, toilets, choking, poisonings, cleaning supplies. So one of the biggest source of injury in infants is motor vehicle crashes. So infants should ride rear facing in the car seat as long as possible until they reach the highest weight or height allowed. Now, it was a few years ago, infants should sit backwards for 1 year, then they changed it to 2 years, and now they're really promoting it as long as you can until they go over the top, the maximum height and weight. So when we think about a baby in the backseat of the car backwards, parents sometimes say, well, their legs are too long. Well, the thing that the American Academy of Pediatrics, which guides our care, says it's better to have a broken leg than a spine or head injury. So legs can bend, and they're at risk for spinal cord injury, head injury due to the ligaments and bones not fully developing if they're sitting forward facing. Infants when they're born have large heads. They're almost like maybe an eighth or a fourth of their body. They're very large heads. And then as they grow, they become more proportionate. So any fall or any injury, they're going to lead with their head. And so parents who put their kids in a little bouncy seat on the counter and they bounce themselves right off, they're going to have a head injury. So that's one of the biggest concerns. So again, it's better to have broken legs, but kids can bend their legs. They can fold their legs up and they should be fine. So that don't make that a reason. Don't let the parent make that a reason for not setting them backwards. There's a good YouTube video if you want to watch that about suffocation. So, and then we also think about, not in Arizona, but I lived in New York for upstate New York for years, is putting huge heavy coats on kids, and then their car seat is not as secure with a big fluffy coat. So they should not have a coat on in the car. Suffocation, so we talk about that in the crib with blankets and stuffed animals and crib bumpers and all of that. They should be in the crib alone. Dress them warmly so they don't need blankets and things, because until they have head control, suffocation is a problem once they start rolling. Choking, so in the infant age, and when they start crawling, they're going to find things on the floor and they're going to pick them up and put them in their mouth. So constant supervision. Water, only a small amount of water is needed. So a dog dish, dog water bowl, toilet. They have toilet locks now, toilet seat locks. They will get into the water, so we need to be careful. There are some swim programs that the American Academy of Pediatrics says to be careful and be aware of them, is that they're called infant rescue, ISR, things like that, where you start them when they're just a few months old, and then the last class, they throw the baby or child into the pool dressed and have them get to the side, because kids will more likely fall in a pool when they're dressed, not in their bathing suit. But be careful of those because they're not 100% secure. The best thing is supervision for any age for water. Nutritional plan of life. So first year, you'll learn a lot about breastfeeding in OB, but of course that follows through to infancy. So breastfeeding and bottle are acceptable ways of feeding them. However, the American Academy of Pediatrics recommends breastfeeding at least until, they recommend it as a preferred method, at least 6 months, but they would prefer it longer. Even partial breastfeeding is going to help the child. If they, some of the groups like farmers would feed them cow's milk, and that is not, doesn't have iron or things like that in it, so that's a problem. But they're growing and changing so much in this year that they need adequate nutrition. And so you'll see that breastfeeding is promoted everywhere, and but support bottle feeding if that's what the parent chooses. So special formulas for kids who have maybe lactose intolerance or allergies or things like that. And then after 6 months, they should be introducing solid foods in addition to the breast milk or formula. So a big thing about introducing foods is do a new one for a few days and then start another one, because you want to make sure they have no allergies to it. So if you give them 3 things at once, then you're not going to know what they're allergic to. Exceptions to breastfeeding, infants with galactosemia, which is a metabolic disorder they test for at birth. It's pretty rare. Obviously, if the mother's using drugs or prescription medications, untreated TB or HIV in developing countries. So the one example I can give you is a baby was brought in by a babysitter, called 911 because the baby was about 6 months old and was lethargic, didn't want to eat. She called the mother, and the mother told her to call 911, and the mother would meet her at the hospital. So baby came in just very lethargic. We put an IV in the baby, never really responded much to the IV. did blood work, and then did a drugs of abuse screen, urine drugs of abuse screen, and it came up positive for marijuana, for THC. And so the doctor went and talked to the mother, and the mother said that she smoked marijuana every day and that she breastfed. And so she said she wasn't going to stop, smoking marijuana. So the recommendation is that that she not breastfeed anymore. And so that call was obviously reported to DCS for them to follow up with, to make sure that the baby was okay. So doing follow-up visits with the baby. So, okay. So if you have any questions, let me know. We can discuss the some of the high points when we have our virtual class. And that is it.